So profitability and cost efficiency in AI telehealth. The number. So let's talk money. Money, 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 money. Here comes the money. So one of your doctors out there's favorite topic. How much am I getting paid? I have to come here at 2 in the morning. You better be paying me some good money. So numbers that drive healthcare's digital transformation. So let's talk about saving, right? Sometimes you can evaluate the worth or the value of what you offer to people if you can tell them, hey, well, look, if I'm saving you $100, wouldn't you give me $70? You save 50. That way I'm also happy. So definitely cheaper way to. So one of the big issues in health, Quebec, 8 million population, about of which 2 million do not have a healthcare provider that's assigned to them. And consequence of this is that a lot of patients, when they get sick, they just head to the emergency department. Horrible, extremely expensive for the government, but they haven't gone around fixing that. So they're dealing with multiple degrees of problems in this situation that I just told you. So AI automation will cut hospital workflow costs about $1 billion per hospital, 484 billion in Medicaid savings, single year telehealth savings at a national level. So government saves money, patients save money, and hospitals become more efficient at not losing money. Money retention. So you're saving money, you're saving the government money. So anybody that is involved in this care process should be getting well paid and in some way compensated. So this is now being recognized more and more. And it's overall what we're seeing. In the future, the patients are going to be having more and more online care. And not just doctors. I mean, literally everybody. Nurses, all sorts of people. Who else? Let me ask you something. Let's say everybody now gets like one of these Optimus robots at home. And let's say they teach the Optimus robot how to make a blood draw. Do you understand how this changes like everything for people? It's like you have a private nurse now at home. The Optimus robot can do all those point of care INRs. If you still have people on Coumadin, it can do actually blood draws. It could check orthostatic hypotension. It can auscultate and it could tell you the results. It's like S1 sound doubled. Not only that, actually tell you this patient seems to be in AFib right now, heart rate of 86. I'm auscultating the right lung field and I'm hearing crackles and mild wheezing at the apex. So it's like a private nurse for everybody. So this is major. Understand this is where we are heading. So eventually it's going to be like, Optimus, do we really need to call the doctor? It's like, no, you don't. I'll prescribe it for you. Here you go. Let's go to the pharmacy. Dr. Prime. It's coming. Employer health plan impact, cost reduction. The other thing is, let's say I work with a lot of trucking companies. You have a robot that serves as anything at home. They have, at your office, moves boxes, at the same time doubles as a nurse. Can you imagine my reach out to these companies now? Say, I am partnering with your robot at your clinic, at your office, so that it can conduct some abdominal examinations if I'm suspecting any sort of illness. This is going to create a lot of tools whereby these robots are going to be given stethoscopes that do not have the tubing system that we do, but it will have recording of the sound. Forget analysis by AI. Imagine they had like something not bigger than this. They would scan the sound of the lung field. And this patient's having a asthma exacerbation. They're like 1,000 kilometers away from me. Go to your pharmacy. I'm sending you some Ventolin and some prednisone for 5 days. Call me in 48 hours. Anyways, we're heading more and more into that, okay? Employer health impact, so reduction costs, virtual visits, health plan for employers. Definitely. I see this. This is probably the biggest service that exists in Quebec. Revenue cycle improvements, patient registration, accurately capture patient data quickly, charge capture, identify billing services precisely. This is very interesting, by the way. Let's say here's the thing. I have a patient that doesn't have a family doctor. They come to my clinic, they open and they create their account online. Let's say I have an AI looking at that information. The patient says, my name is, John Doe, but I was born 17th March 1972. It's like, well, this patient is above 50. It's a male patient. The AI could go like, well, for that, he needs to get influenza shot, Tdap if he hasn't had one recently. We could do like diabetes screen, PSA, RSOSI, or occult blood, fecal occult fit test, fecal immunochemical testing to detect colon cancer, basically. So all this can be prepared by AI, is what I'm saying. And just from gender, age of the patient. So this is where communication gets enhanced by AI, card capture. So how do you actually bill for a medical visit that would prepare all that? So what else can you automate? Once the AI sees that, okay, this is a 40-year-old woman, we need to do a mammogram, screening mammogram, simple. Prepares the yearly evaluation, will ask all the questions to the patient immediately. Do you have any of these conditions? Negative review of systems, age of the patient. It would be good for you to do just a general checkup with this. Can you offer this to patients? Like, do you need to examine a patient in order to do a mammogram that's a screening mammogram, or like fecal occult testing or diabetes checkup with a hemoglobin A1C from venipuncture? Do you need to have them in person to give them that requisition? The answer is no, you don't. DEXA scan. Things are classical. Pneumonia vaccine, hepatitis B vaccination. These are classical things that you don't like. We could automate that to make it efficiently. And then you have the AI going like, this is how you should bill it, get your revenue, and then could eventually do that. Today at 7:20, July 20th, 2025, I saw John Doe at 15:42. Billing codes are this, screening this. I will make $40, $50. I don't know how much you make, for example. Requisition sent over to the patient. We're pending revision of the results and discuss it over with them. Okay. Receive payments 25% faster with AI. Sends claims error-free. So reducing unnecessary care, imaging reduction, AI care cuts unnecessary imaging by about 24%, ER optimization. This depends on the tools. It's kind of a wide statement. ER optimization, automated triage, reduced emergency load by about 19%. This is where I'm trying to get instant HPI to people here in Quebec, and it's very difficult because the system is very fractioned, and the people at the top, they have understanding of what needs to be done, but they're not even doctors, number one. Our health minister is an accountant, the health minister. So they're used to numbers, and they don't have experience as far as like, what do we need to do? What do we need to optimize? They know, well, we should optimize things with AI. They just don't know what. So this is where you already know your job as a physician, what you ought to do. You know where this requires energy and you have experience to some degree. But automation and AI implementation has to be done by physicians. It doesn't make sense otherwise. They have to hire somebody that knows what the hell they're doing. So we already have studies in similar type settings that automated triage reduce emergency room load by 19%. When I wrote to the government, I told them, this is the following thing that you should do. We have services like Info Santé 811 in Quebec. So these are triage systems. People call over the phone. They say, I don't have a doctor. I need to be seen. I feel sick.